By the end of the day, do your legs feel heavy, swollen, and tired, like they are filled with wet sand? Do your socks leave deep grooves in your ankles? Have you noticed veins bulging or the skin near your ankles changing color? If so, your legs are not just tired, they are begging you for help. And in the next 20 minutes, I am going to show you the 6 signs they use to ask which of those signs is an emergency and exactly what you can do this week to answer them. I am Dr. Marcus Okoro, board-certified cardiologist and heart surgeon. Here's something I want you to understand right away. Your legs perform the hardest circulation job in your entire body. The blood in your feet has traveled the farthest distance from your heart, and then it has to fight its way back up, against gravity, the whole way. When circulation begins to fail with age, your legs are almost always the first place it shows. That is not bad luck, it is physics, and it means your legs are an early warning system if you know how to read them. Stay with me all the way through, because there is one distinction that changes everything. The difference between an artery problem and a vein problem. They can look almost identical from the outside, and yet the treatment is completely different, and getting it wrong can be dangerous. Most videos never explain this. I will. And near the end, I will show you the exact red flags that mean you should call your doctor this week, not someday. Let me start with Russell. Russell was 72, a retired postal supervisor, and he came to me frustrated. He told me that by the end of every single day, his legs felt like they were filled with wet sand, heavy, aching. He would peel off his socks at night and see deep grooves pressed into his swollen ankles like the sock had been carving into clay. And lately, something new. The skin just above both ankles had turned a rusty brownish color that would not wash off and would not fade. His family doctor had told him it was just his age, that his heart checked out fine, and to put his feet up more. But Russell's heart was not the problem. His veins were. The valves inside his leg veins, the tiny one-way doors that are supposed to keep blood moving upward toward the heart, had worn out and were leaking. Blood was pooling in his lower legs, the pressure was building, and that pressure was forcing fluid and iron out of his blood vessels and into the skin. That rusty brown color was iron staining. His skin was literally being damaged by trapped blood, and it was heading in one direction, toward an open, painful sore called a venous ulcer, the kind that can take months to heal and can become seriously infected. We caught Russell in time. With proper compression stockings, daily elevation, and a simple movement routine I will teach you, his swelling came down, the heaviness lifted, the aching stopped, and the skin damage halted before it ever broke open. His legs stopped begging because we finally listened. Let me teach you to listen too. But first, the distinction that everything depends on: arteries versus veins. Your circulation is a two-way road. The arteries are the delivery trucks. They carry fresh, oxygen-rich blood from your heart down into your legs and feet under high pressure to feed the muscles and tissues. The veins are the return trucks. They carry the used, oxygen-poor blood back up from your feet to your heart under low pressure, working against gravity, helped by little valves and by the squeezing of your calf muscles. When the arteries are the problem, when they get narrowed and clogged, which is called peripheral artery disease, the issue is not enough blood getting down to the legs. That causes cramping when you walk, cold and pale feet, hair loss on the legs, and sores that will not heal because the tissue is starving. It is an oxygen delivery problem. When the veins are the problem, which is far more common and is called chronic venous insufficiency, the issue is that blood cannot get back up, so it pools in the lower legs. That causes heaviness, swelling, bulging veins, and skin discoloration. That is Russell's problem. It is a drainage problem. Here is why the difference matters so much. For a vein problem, we often want you to elevate the legs and use compression to push the pooled blood back up. But for a severe artery problem, tight compression could actually reduce the already limited blood getting down. That is why you must never just guess and wrap your own legs tightly without knowing which problem you have. The signs I'm about to give you will help you tell the difference, and your doctor can confirm it with simple, painless tests. Keep both roads in mind as we go. Now, the 6 signs. Sign number 1, heavy, tired, aching legs, especially by the end of the day. This is the most common early sign of venous trouble and the most ignored, because everyone expects tired legs as they age. But notice the pattern. Venous heaviness gets worse as the day goes on, and worse the longer you stand. Because gravity is pulling more and more blood down into legs that cannot drain it. It feels better when you lie down and elevate your legs because now gravity helps the blood drain back. If your legs feel fine in the morning and like lead by evening and propping them up brings relief, that is the fingerprint of failing vein valves. It is your legs telling you the return trucks are struggling. Do not wait until swelling and skin changes arrive to take it seriously. This is the earliest whisper, and it is the easiest stage to treat. Sign number 2, swelling in the ankles and lower legs. Doctors call this edema. At the end of the day, look at your ankles. Press a finger firmly into the swollen area just above the ankle bone for a few seconds, then let go. If it leaves a dent that slowly fills back in, that is pitting edema, and it means fluid is collecting in the tissues. In venous insufficiency, this happens because the pooled blood raises pressure and squeezes fluid out into the tissue. Swelling that is worse at the end of the day and better in the morning, affecting both legs, is usually a circulation and vein issue. But swelling can also be a sign of heart failure, kidney problems, or a medication side effect, so persistent swelling always deserves a medical evaluation to find the cause. And now I have to stop and give you the single most important warning in this entire video because it lives right here in the swelling sign. If one leg suddenly becomes swollen, noticeably more than the other, and it is painful, warm to the touch, red or tender, especially in the calf, do not wait, do not elevate it, do not massage it. That can be a deep vein thrombosis, a blood clot in the deep veins of the leg. And the reason it is an emergency is that a piece of that clot can break off, travel to the lungs, and cause a pulmonary embolism, which can be fatal. Sudden, one-sided, painful leg swelling is a call your doctor now, go to the emergency room situation. Both legs swelling slowly over months is usually chronic circulation. One leg swelling suddenly and painfully is an emergency. Please remember the difference. It can save your life. Sign number 3, varicose veins and bulging veins. These are the twisted, rope-like blue or purple veins that bulge out, usually on the calves and the backs of the legs. Many people think of them as only a cosmetic nuisance. They are not. Varicose veins are a visible sign that the valves in those veins have failed and blood is pooling and flowing backward. Some people have them for years with only mild symptoms. But varicose veins can lead to the same progression Russell faced: swelling, skin changes, and eventually ulcers, if the underlying pressure is never addressed. And there are smaller versions too. Spider veins, those fine red or blue web-like lines, and clusters of tiny veins around the ankles, sometimes called a venous flare, are early markers of the same rising pressure. If you have bulging veins along with heaviness or swelling, that combination means the vein disease is active, not just cosmetic, and it is worth seeing a vein specialist who can check the valves with a simple ultrasound. Sign number 4, brown or rusty discoloration of the skin near the ankles. This was Russell's alarming sign. And it is one of the most important on this list because it means the circulation problem has been present long enough to start damaging the skin. When blood pools in the lower legs under high pressure for months and years, red blood cells leak out of the vessels and break down, releasing iron. That iron stains the skin a rusty brown, usually in a band around the inner ankle. The skin may also become thick, tight, hard, or shiny, and sometimes itchy or inflamed. This is called stasis dermatitis, and it is the last warning stage before the skin breaks down into a venous ulcer. If you see brown staining around your ankles, please do not dismiss it as age spots or an old bruise. It is a signal that your legs need medical attention before an open sore develops. Because once these ulcers open, they are stubborn, painful, and prone to infection. Let me tell you about Gloria. Gloria was 68, and she came in worried about what she thought was a bruise on the inside of her right ankle that had been there for 3 months and would not fade. She could not remember bumping it. It was brownish, a little reddish, and the skin around it felt tight and itchy. It was not a bruise. It was stasis dermatitis from venous insufficiency she did not know she had. Her leg had been mildly swelling for a year, but she had chalked it up to standing at her kitchen counter. We started compression and elevation and got her to a vein specialist. Her ulcer never formed. But Gloria said something I hear all the time. She said, "I thought a bruise that would not heal was just what happens when you get older. It is not. A mark on your lower leg that will not fade in a couple of weeks is your body asking for help. Answer it." Sign number 5, cold feet or 1 foot colder than the other, and changes in color. Now this sign can point either way, which is exactly why it is so useful once you know how to read it. Feet that are cold, especially pale or bluish, can signal an artery problem, not enough warm, oxygen-rich blood reaching the feet. If one foot is consistently colder than the other, that one-sided coldness is a classic sign of a narrowed artery on that side, and it deserves prompt evaluation. Color changes matter too. A foot that turns pale when you raise it and deep red or purple when you lower it points toward artery disease. A foot or ankle that is more brownish and swollen points toward vein disease. Cold, pale, one-sided, think arteries. Warm, swollen, discolored both sides, think veins. Either way, cold feet that used to be warm are a circulation change, not just a quirk of getting older. Sign number 6, numbness, tingling, and restless legs, especially at night. When circulation to the legs and feet is reduced, the nerves that live in that tissue do not get the oxygen and nutrients they need, and they start to misfire. That produces numbness, a pins and needles tingling, a burning sensation, or that maddening urge to move your legs at night that keeps you from sleeping. Now, numbness and tingling can also come from diabetic neuropathy or a pinched nerve in the back, so it is not always circulation. But when it comes along with the other signs, the heaviness, the swelling, the cold feet, it points to circulation as the driver, and here is a practical clue. Circulation-related leg discomfort at night often eases when you dangle your legs over the side of the bed or stand up, because gravity briefly improves blood flow. If moving or dangling helps, circulation is likely part of the story. So those are the 6 signs. Now let me give you what you actually came for. What you can do this week to help your legs. 5 things, starting tonight. First, move your calf muscles often. Your calf is your second heart. Every time you contract it, it squeezes the deep veins and pumps blood back up toward your heart. If you sit or stand still for long periods, that pump goes quiet and blood pools. So every hour, do 20 ankle pumps. Point your toes down, then pull them up 20 times. If you are sitting, stand up and walk for a couple of minutes every hour. Movement is the single most powerful thing you can do for leg circulation, and it is free. Second, elevate your legs. For venous problems, this is powerful. Once or twice a day, lie down and raise your legs above the level of your heart for 15 to 20 minutes. Prop them on pillows or against a wall. Gravity, which fights you all day, now works for you, draining the pooled blood and fluid out of your legs. Russell did this twice a day, and his evening swelling was transformed. Third, and only if your problem is venous, not a severe artery problem, consider compression stockings. Graduated compression stockings squeeze tightest at the ankle and less as they go up, mechanically helping the veins push blood back up. But, and this is important, if you have significant artery disease, tight compression can reduce the already limited blood getting down to your feet. So please, before you buy compression stockings, ask your doctor to confirm your circulation can handle them, often with a simple, painless test called an ankle brachial index. Do not guess with your own legs. Fourth, walk every day. Walking is the perfect leg circulation exercise because it rhythmically works the calf pump and, over time, encourages your body to build new small blood vessels around narrowed areas. Even 10 to 15 minutes a day makes a measurable difference. Start where you are and build slowly. Fifth, manage the pressures that damage your vessels. Keep your blood pressure controlled, keep your blood sugar controlled if you are diabetic, stay hydrated, keep your weight in a healthy range. And if you smoke, please stop. Smoking is one of the most powerful destroyers of both arterial and venous circulation there is. Every one of these protects the vessels in your legs. Now, before I recap, the red flags. Call your doctor this week or go to the emergency room if you have any of these. Sudden swelling in one leg that is painful, warm, or red. An open sore or ulcer that is not healing. Skin that has turned brown, hard, or is breaking down. Leg pain that comes on when you walk and stops when you rest, especially with cold or pale feet, or any sudden severe change in color, temperature, or feeling. These are not wait-and-see signs. These are this week's signs. Let me recap the 6 signs your legs are begging for help. 1. Heavy, tired, aching legs that worsen through the day and ease when you lie down. 2. Swelling in the ankles and lower legs. And remember, sudden one-sided painful swelling is an emergency. 3. Varicose or bulging veins, which are never just cosmetic. 4. Brown or rusty skin discoloration near the ankles, the last warning before an ulcer. 5. Cold feet or one foot colder than the other, and color changes. 6. Numbness, tingling, or restless legs at night from starved nerves. And the one lesson underneath all 6, learn the difference between an artery problem, where blood cannot get down, and a vein problem, where blood cannot get back up. They look alike, but they are treated differently. Your legs do the hardest circulation work in your body every single day for your whole life. When they start begging for help, the kindest and smartest thing you can do is listen early. While the fixes are still simple. Russell listened. Gloria listened. Their legs got better. Yours can too. I am Dr. Marcus Okoro. If your legs show even one of these 6 signs, tell me in the comments which one. I read every single one, and your comment may be the reason another person finally gets their legs checked. If this video helped you, please share it with someone you love who has been putting their swollen feet up and calling it old age. And if you are not subscribed yet, subscribe and come back, because every day I am here to help you protect your heart, your circulation, and your independence. Take care of yourself, and I will see you in the next one.